Hey guys, so today we're going to talk about directional terms. Directional terms are words that we use to describe one body part in relationship to another. So keep in mind that we're comparing two different things. We don't just say the head is superior, but we have to put something else with that statement. The head is superior to the chest, for example. So as you guys are listening, please complete the notes, the directional terms discovery, as you're listening to this presentation. And so keep in mind, it's going to start off with the review with the anatomical position that we looked at earlier. And then it's going to get to these new terms, and it's going to ask you to describe them in your own words, but then also compare them to the book or the notes that I'm giving you in this video. The final component is you're going to be asked to add arrows to show how this is relative to our own bodies so that we can practice using these terms correctly. So let's get started. So I thought the best way to do this was to show you an image of the body. And with this, I'm just gonna try to use a highlighter and highlight these words as we go through them. Now, another tip or piece of advice that I would share with you looking at the worksheets you're asked to fill in, my recommendation is these terms oftentimes have an exact opposite. And so I think it's really helpful if you pair them with your opposites. And I did happen to put them in order on the paper. Okay, so going forward, now we're going to compare where these terms relate to the body. And so this first pair is a little bit tricky because we're only seeing a section of the body, but I am going to try to use my highlighters, so bear with me a second as I get this going again. Just to kind of show you, it says in this picture, this is the anterior view. And so when we look at anterior, that's basically referring to towards the front of the body. And then the opposite, we can't see it, but imagine seeing the back side of this body. That would be the posterior view. So again, partnering them with their opposites. The next two terms that we have, we look up here at the very top, and this is superior. Superior means toward the top or toward the head. And then the opposite of that term is inferior. And a lot of times we think of this as towards the feet or the lower section of the body. Then we have distal and proximal. And so if you look at distal and proximal, we're basically referencing the limbs of the body. And so for this example, we're taking a look at the arm. And so when we take a look at distal, distal means farther from the point of attachment. We think about how our arm is attached via our shoulder. So distal means it's more distant from where it's attached. So for example, our fingers are distal to our shoulder. Now we can take that statement and flip it around to the exact opposite, and we can say that our shoulder is proximal to our fingers, meaning that our shoulder is closer to the point of attachment than our fingers. So again, it's really interesting to take a look at how we can utilize this terminology to be able to make sure that everyone is understanding specifically what is going on with the body. All right, so the next pair of terms that we're going to take a look at are medial and lateral. So if we take a look at the top, we can see that medial is here by the midline. So imagine this line going right down the middle of our body. Medial means it's more towards the middle. And so for example, we could say that our nose is medial to our eyes because our nose is more towards the middle than our eyes are. And again, we can flip that around and we can say that the eyes are lateral to the nose. So hopefully you can see how these terms are utilized, and again, showing the opposites. All right, so the last two are a little bit trickier to see with this image as well, but they are superficial and deep. And so when we talk about superficial, we are talking about what's on the surface. So this term could be used to describe an individual if they are superficial. They're only concerned about what's on the outside, what's on the surface. However, the opposite of that term is deep. And deep is pretty self-explanatory. It is deeper inside of the body. So imagine when we're doing dissections later on, we will cut using scalpels, using scissors to go deeper within the body. And so this image that we're seeing here, we can see all these organs. It's kind of giving us the see-through version of these different components. So you can have some ideas of where these structures are located. But this picture is showing the deep portion, deeper portion of the body. We can't really see the skin except for here along the edges. So we would say that skin is superficial, more towards the surface than bones or muscles. And then we could flip that statement around and say that the bones are deep compared to the skin. So I hope that makes some sense as we talk about the directional terms. Thanks for listening, guys.